For complete instructions, including cautions and warnings, please refer to the ON-Q patient guidelines. These are also available on our website, myonq.com. Your doctor has decided to provide you with the ON-Q pain relief system. It's a disposable, non-narcotic pump filled with local anesthetic to help manage your post-surgical pain for up to 5 days. Local anesthetics are medications similar to Novocaine that you get at the dentist's office and numb only a targeted area. The ON-Q pain relief system may provide better pain relief than with narcotics alone, reduced need for narcotics, more comfortable recovery after surgery, quicker return to normal, and earlier discharge home. Your physician has selected the ON-Q pump with SelectaFlow to manage your pain. The ON-Q pump is connected to a small catheter or tube, which is inserted by your doctor. Depending on your procedure, the catheter will be placed near the surgical incision site or under the skin next to a nerve near the surgical area. The ON-Q pump automatically and continuously delivers the medication at a slow flow rate. It is completely portable and may be placed in a small carrying case. The SelectaFlow is an adjustable flow controller used to personalize your pain management. If your doctor has instructed you to change the flow rate, then lift the plastic cover. Turning the dial toward the plus sign increases the flow rate. Turning the dial towards the minus sign decreases the flow rate. Your doctor will instruct you on what flow rate to select. Make sure the entire number is within the window below the milliliters per hour mark. If the rate is not properly positioned in the window, you will not be able to close the cover. The cover will close completely only when the flow rate is properly selected. Warning: do not change the flow rate on the SelectaFlow dial unless instructed by your doctor. Changing the flow rate without your doctor's instruction may result in the wrong dose of medication delivered, which could cause serious injury. The pump delivers your medication very slowly. It may take longer than 24 hours after your procedure to notice a change in the size and look of the pump. Do not expect to see a change in the pump every hour. As the medication is delivered, the pump ball will gradually become smaller. In time, the outside bag on the pump will begin to get looser and wrinkles will begin to form in the bag. The pump's appearance may vary depending on the size and flow rate of your pump. Make sure the white clamp on the tubing is open and moves freely on the tubing. Make sure there are no kinks in the pump tubing. Do not tape or cover the filter. If you are using ice or cold therapy, place it away from the lower part of the pump tubing that contains the flow controller. Make sure to keep the SelectaFlow outside your clothing. When is my pump empty? Depending on the size of your pump, it may take 2 to 5 days to deliver all the medication. All your medication has been delivered when the ON-Q pump is no longer full. What should I do with the pump when I'm sleeping? Place the pump on the bedside table or on top of the bed covers. Do not place the pump under the bed covers where the pump may become too warm. Do not place the pump on the floor or hang the pump from a bedpost. What should I do with the pump when I'm bathing or showering? Your doctor will tell you when it's okay for you to bathe or shower. Follow your doctor's directions for bathing or showering. Take care to protect the catheter site, pump, and filter from water. Do not submerge the pump in water. Caution: do not squeeze the pump. It has the force necessary to deliver your medication. Here are some things to be aware of when using the ON-Q pain relief system. Be aware that you may experience loss of feeling at or around the area of your procedure. If numbness occurs, take proper measures to avoid injury. Be careful when placing hot or cold items on the numb area. Warning: the following symptoms and situations may represent a serious medical condition. If you experience any of these symptoms, immediately close the clamp on the pump tubing and call your doctor or 911 in case of emergency to prevent serious patient injury. increase in pain, fever, chills, sweats, bowel or bladder changes, difficulty breathing, redness, warmth, discharge, or excessive bleeding from the catheter site, pain, swelling, or a large bruise around the catheter site, dizziness, lightheadedness, blurred vision, ringing, buzzing in your ears, metal taste in your mouth, numbness and or tingling around your mouth, fingers, or toes, drowsiness, confusion, catheter disconnects from the pump or leaking occurs at the pump connection. The ON-Q Pain Relief System. Get back to your life after surgery sooner. For 24-hour product support, please call 1-800-444-2728. For medical advice, please contact your doctor. For more information about ON-Q, please visit myonq.com. There are inherent risks with all medical devices. Please refer to the product labeling for indications, cautions, warnings, and contraindications. Failure to follow the product labeling could directly impact patient safety. The physician is responsible for prescribing and administering medications per instructions provided by the drug manufacturer. Refer to www.halyardhealth.com for product safety technical bulletins.